Hi, I am Dr. Rekha, Prashanth, obstetrician and gynecologist and specializing in infertility from past 25 years. I am consultant at Varalakshmi Hospital, Madivadu, Manipal Hospital, Sajapur Road and Apollo Cradle, Kormatla. During this past 25 years of experience, we have come across many cases, but of most important or dreaded diseases which we have come across is cervical cancer. Let us understand what is cervical cancer, what ways we can prevent this and treat this. Did you know in every 8 to 10 minutes a woman dies of cervical cancer? So first of all, we should now understand what is cervical cancer. It is the cancer of the cervix, what we call as the mouth of the uterus, and this connects the vagina to the uterus. So when the cancer starts in the cervix, it is called as the cervical cancer, and it is mainly caused by a virus called the human papilloma virus or the HPV virus. And this HPV virus has many strains, many subtypes, out of which the most important are the 4 subtypes. This cervical cancer spreads from person to person through sexual activity. It often causes no symptoms, and that is why this cervical cancer is not being diagnosed at an early stage, because patients come with symptoms only at a later stage when the cancer is fully developed. Now, to prevent this cervical cancer to be fully developed, we have different stages and options wherein we can do a screening test, we can diagnose it, and we also have an options of preventing the cervical cancer. So before we know how to do a screening test, we should know what are all the risk factors of the cervical cancer. The risk factors are mainly smoking, multiple sexual partners, multiple childbirths, then weak immunity of the women, then HIV infection, and of most important is the long-term usage of oral contraceptive pills. So the preventive measures to be taken are mainly to stop smoking, prevent multiple partners, practicing safe sex, and finally important is the cervical cancer vaccination. So to do so, the most important is the regular cervical screening test. Now, what is this cervical screening test? This is a pap smear test which we usually start from the age of 30 years plus, but can also be done at an earlier age if a woman is exposed to sexual activity. Screening means to check for the cervical cancer much before the symptoms starts. One is a pap smear, which is usually done once in a year, and the other one is a HPV testing by liquid-based cytology, which we do it once in 5 years. This is more sensitive test. So one might think, why should these tests be done so regularly once in a year? This is because the cervical cancer usually takes 3 to 5 years or sometimes even up to decades to develop into a full stage cancer. So these high-grade cervical cells, initially the normal cells, when they are infected with the HPV virus, they turn into pre-cancer stage and then to cancer stage, which usually takes a long period. So much before a woman develops cancer, she can be detected and treated for the same condition. So here we have an opportunity to prevent this at different stages, and we have different options for prevention. This pap smear test is a simple test and it can be done within few minutes, say 2 to 5 minutes. It is not painful and it is an outpatient procedure where the patient doesn't need any admission. The results can be available within 2 to 3 days, and once we get to know that the pap smear test is negative for malignancy, the next option we have is a vaccination. The most important here, vaccination, because this can be given to ages as early as 9 years up to 45 to 50 years of age. So we divide the vaccination into 2 groups, wherein we have a 4-strain vaccine and a 9-strain vaccine. 4-strain vaccine is usually given to girls who are not exposed to sexual activity, and 9-strain is given only after a pap smear test comes as negative. This is given in 3 doses, 0 dose, 2 dose and 6-month dose, and this covers a woman from getting cervical cancer up to 90 to 95%. Hence, I think all of you should understand the importance of this vaccination So I kindly request all of you to please get yourself tested, especially those who are above 30 years of age, and prevent this cervical cancer. So let us all join hands together in preventing cervical cancer and make our country and universe a cervical cancer free country. Thank you.